have a patient that has come in and is needing help with their oxygen, and they just came in and they're breathing spontaneously. So I'm going to choose to do an Ambu bag. Now with this Ambu bag, I'm going to choose a proper fitting of mask. So I'm going to try one size on the patient to see which one would fit perfectly for them. And so see, this one here is too small. It doesn't quite fit around their nose, and you won't be able to get a tight fit or seal around their mouth and nose together. So here I have a larger one. And this fits just right over the nose and mouth, and I'm able to get a tight seal around the nose with my C shape that I form here. Now when I go to assess a patient, I need to make sure I need to check their vital signs and everything. Then I would hook like a pulse oximeter onto them to see their SpO2, see where they are at. So when I prepare this, I need to have the accordion here. So this I would connect over here. And I would turn it up to 15. Liters for a minute. I'd make sure my bag gets full. And I'd properly place the mask on to the Ambu bag here. Now when I do this, I'm going to make sure I have this, the top part here on the nose where there's like a little triangle there. I need to make sure that covers the nose, then the mouth, and then I will create a tight seal around the nose, and I will lift up the patient's chin to open up the airway. Now when I do this, I need to do at least 12 to 20 breaths per minute. So I would go, and if I can't quite get a seal around like the patient's mouth, as you can see, I'm not getting quite the tight seal that I need to perform with the Ambu bag. It's leaking. So you can also have somebody help you with keeping it tilted. When you have somebody tilted, then you can get that tight seal around the patient to get them the air that they need. So as I'm going along with this, I need to check along the way and watch the SpO2 and make sure this bag continues to stay inflated. If it doesn't stay inflated, I may need to just wait a minute, second to make sure it inflates so that the patient gets the proper flow into them. So as I'm going through, after I'm all done with these things, I need to remove the mask. And I would shut off this here, the regulator. And then I would pop that off. And then I would store this off to the side, and then I'd reassess the patient to make sure their vital signs, see where they are at, check their SpO2, and then once I am done, I'd make sure, like as always, I'd like have my proper gloving on when I do the procedure, and wash my hands, and when I'm done, dispose of anything that I have used. Like if I have like a disposable mask, I need to make sure this is disposed of, and then you are done with the patient.